Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning into the latest edition of the Checkup. So, when he's sworn in as president on January 20th, Joe Biden's going to have some razor thin majorities in the House and the Senate, as we know, to try to advance his legislative agenda. He'll also be continuing to build out his team at HHS, and they'll obviously be focused on the COVID-19 pandemic and rolling out of the vaccines. So, what does all this mean for health policy? Well, I'm excited today to be joined by Chip Kahn, who's a longtime veteran of the Washington, D.C. scene. He's president and CEO of the Federation of American Hospitals, which represents the for profit side of the sector. We're going to talk about some of the things that we might expect out of a Biden administration. Chip, thanks so much for being with us. It's good to see you.
Happy to be here, Matt. Thanks.
Thanks so much. So let's talk first. We were talking before we came on camera here just about the mood and the scene in Washington, giving everything that unfolded with the storming of the Capitol. Can you put in context, you worked on the Hill, do you think there's going to be any sense of unity? How does the legislature come out of this situation as we look towards January 20th?
Well, frankly, the last 4 years with the Trump leadership has been exceptional. It's been different than any experience I had, I hate to say, over the 40 years that I've been in Washington. And these few days leading up to the inauguration are no exception to that exceptionalism. We've seen drama at a level that is completely unprecedented. So it's really hard to say what happens in this period right after January 20th. I mean, I hope we return to some level of normalcy and civility in Washington, even with the razor-thin majorities in both houses of Congress. I think there is an opportunity for legislation. There is an opportunity for somewhat of a honeymoon, particularly for someone like Joe Biden, who has been talking about unity. But we're going into that period over the next few days with such a different kind of an environment we wouldn't have expected, that it's really hard to predict what's going to happen.
Yeah. Well, so let's talk a little bit about where you think there might be some common ground, where this Congress, it's a 50-50 split in the Senate. The Democrats get that one tie-breaking vote with the vice president, Kamala Harris, when she takes over. Where do you think there might be some common ground for the parties to work together on health policy?
Well, I think there's a general consensus that COVID is both a health crisis and an economic crisis, and that we won't get the economy back going again at the level that we need it until COVID, the health crisis, is solved. And the attention of the Trump administration to COVID has been inconsistent at best. I think we'll definitely get a different kind of leadership starting with the new administration. And so their focus on COVID, I think, will frankly be a good start, because if nothing else got done over the last year, there was COVID legislation. There was a consensus that we had to focus on the COVID and on the resulting economic effect of COVID. So I'm a bit optimistic that we will start off the year with some kind of COVID/stimulus bill that may get a lot of support. And hopefully out of that, two things will happen. One, we'll further our effort to deal with the crisis. And two, we'll begin to set precedents of relationships between Republicans and Democrats and Congress and the White House that will bring about a new day of working together. Now, what the bounds of that working together are, we're going to have to test, because the gulf between Republicans and Democrats on many, many issues remains very deep.
Are there some things that you would like to see in a next COVID package, either COVID related or outside of that? We got obviously the surprise billing package through in the last go round. Is there anything new you'd like to see in a new COVID relief bill that goes through.
Yeah, this is in comparable economic crises. You saw some attention to health insurance for the newly unemployed. We have a framework in ACA that I think could provide an easy avenue to help protect many millions of Americans who have lost their insurance. And so I think job one, beyond the testing, the vaccines, the treatment, or bringing people funds to help them survive economically, I think job one is to make sure they have health security. And we can bring them that through making sure that this ACA framework works. This is going to be a hard one, though, because from the Republican standpoint, this has been the great dividing line over the last decade. Obamacare, ACA. I won't even say optimistic. I guess I'd just say hopeful that we're at a point at which we can realize that coverage is key, and it has an economic effect. It has a healthcare effect. It has a mental health and behavioral effect, and action is needed in that area. I'd say beyond what's already been done or things we need to continue from the earlier COVID bills, coverage is key.
And you'd like to see that in an actual COVID bill, some sort of coverage extension or subsidy enhancement?
Yes, I think there are a lot of different avenues they could take. They could change the rules on the exchanges and add more subsidies. They could help those that are still eligible for COBRA with subsidies. Some of these provisions were in earlier Democratic bills, the HEROES Act last year, and some of the other legislation that was offered up, or at least the proposals. And I think that's the next important step, because we have tens of millions of Americans who are exposed, and we need to get all of them covered so that at least they feel secure from a healthcare standpoint.
What about liability protection, which obviously is a big thing for Mitch McConnell? How much do you think that's going to play into any negotiation process?
I think from the standpoint of the hospital, which is in the midst of dealing with COVID, that liability protection is extremely important. This is a 1 in 100-year kind of event. We will have issues here, and we really need to be, our caregivers need to be protected as we work to treat our patients. So we're very strongly for liability protection. That obviously was one of the key provisions that Senator McConnell and other Republicans in the Senate wanted to see included in the last COVID bill. Frankly, though, I have my doubts because of, in a sense, this great political divide, and this is one of those issues that sits on that divide, that we're likely to see much progress here. I hope it could be, you'd think it would be a consensus issue, but it's not. So I think in a COVID bill, maybe some form of it might emerge, but at least at this stage, it's hard to envision exactly what it would look like.
Right. And so outside of COVID relief, Chip, if we think about the way that the Democrats might be able to use budget reconciliation to move some of their agenda items, how much do you think they're going to have to rely on budget reconciliation, which doesn't mandate, they don't need the 60 votes, they just need the 50, 51 with Kamala Harris. How much do you think they're going to rely on that?
Well, we don't know what their strategy will be yet, how much they'll try to do in a COVID bill, some kind of spending bill, and how much they'll try to do in what's called budget reconciliation, which is a process that in the Senate only requires 51 votes to pass, and basically can't be filibustered because you only need 51 votes. I don't know what their strategy will be between the two bills. They may decide to put everything in a reconciliation bill so that they can control the bill. It'll be more of a Democratic bill. I think that will be divisive. On the other hand, if they can get to 51 in the Senate and get the 218 in the House, then they will pass Democratic legislation.
Yeah.
My gut is that the stimulus bill, the COVID bill, is more likely to be a bill that at least there's an attempt to make it bipartisan. And then they'll hold reconciliation in abeyance or in reserve, so that if negotiations break down, they can turn to reconciliation. There are limits to what they can legislate in reconciliation. And there has been discussion of removing this rule called the Byrd Rule, which requires that whatever you're doing in the legislation has to be either spending or revenue raising. And after a 10-year period of the budget window, you can't raise the deficit. So it limits your flexibility. Insurance reform and in healthcare and other kinds of areas like that don't fit well into a reconciliation bill, because they might have to do with private sector rules and not with public sector spending or revenue increases.
Right.
I think taxes will be the big issue. If the Democrats decide they want to raise taxes for whatever reason that fits into their equity agenda or their agenda to reduce the deficit or whatever, that'll be of great difficulty, but that would have to be in reconciliation.
And so if we think about healthcare and where the Democrats may go, obviously there's so much focus on COVID at the beginning. At what point does Biden and his team, what point can they start to pivot to some of the other things he campaigned on, maybe a light version of a public option, something along the lines of, the Medicare age? At what point can he start to shift?
I think that at first, he has the right message now, and he's going to stick with it, which is COVID, COVID, COVID. I can't say at this point, none of us know, whether by the summer or the fall of this year that COVID will be moved aside. There'll be sufficient vaccination that you're going to move away from worry about hospital crowding. You're going to be moving away from the economic effect. Will restaurants reopen by the summer or the fall? We could go through all the aspects of the economy. Will we get to 6% growth, which we would get to if in a sense all the economy got going again? I don't think he can get to big changes until we get to that point, unless they decide that they're going to go for the gusto in a reconciliation, and he could do things earlier in getting a reconciliation done. But I think that comes with great risk. I brought up the taxes issue earlier. That probably would go hand in hand with any kind of change in coverage that you described. Frankly, from the provider standpoint, from the hospital standpoint, our view is that those changes, whether it be the public option or expansion of Medicare, is unnecessary, would cause more problems than coverage they would create, and that we have a framework within the existing ACA that frankly can get us to universal coverage in a way that's much more compatible with our private system.
So I want to talk about the regulatory piece, but real quickly on the ACA, because we're waiting for the Supreme Court to rule on that case. Would you expect this Congress early on to try to take care of the individual mandate question so that the case in front of the Supreme Court really is deemed moot?
Well, this will be one of those questions for whether Republicans are willing to cross some Rubicon and give up that great divide which Obamacare has been, as to whether they'd agree to something. I just don't know how high a priority that's going to be, because you can't rely on a hearing. But frankly, the hearing that took place a few months ago in the Supreme Court seemed to indicate that there really wasn't much interest for most of the judges in following this sort of peculiar theory that though the plaintiffs came up with to try to dismantle ACA. Now, I could be completely wrong. In June, we could get some kind of majority for going after the entire law. But I think at least at this point, it probably, hopefully, and I think most commentators would guess that there's a low probability. So yes, it could be resolved by simply taking the individual mandate and repealing it, and I think it'd be a great idea to do that. I just don't know, with all the other things on people's plates, whether that'll be something that people want to contend with, considering all the other priorities we have, and that it just doesn't seem like the trajectory of the court is in the wrong direction on ACA.
Right, right. So, Chip, in the last minute or two we have left, I do want to pivot to the regulatory side, because it's obviously an area that Biden has much more control over, where we don't have his pick yet for CMS at the time of this recording. But if you think about what you might be looking for, what the Federation members might be keeping their eyes on, are there two or three things on the regulatory front that you're really focused in on out of a Biden administration?
Well, I think in the last administration, there was some language on physician-owned hospitals that was problematic regarding expansion. I'm hoping that could be walked back. I think in terms of the implementation and the specifics on transparency, that could be clarified so it really would serve the patient and not some other purpose. And finally, I think in the area of Medicaid, we need to get back to first principles. Medicaid needs to be used and designed to cover as many low-income people, as many low-income Americans as possible. And the work requirement and some of the other changes that were made through waivers by the administration, we think are counterproductive and will only lead to narrowing rather than expanding coverage. For those low-income Americans, their link to health care and to the best health care is through Medicaid. That's the important part of the ACA framework that we need to make sure is expanding rather than contracting.
Right. Well, it'll be really interesting to watch all this unfold, Chip. I'm sure we'll stay in touch over the first 100 days for sure, but beyond that, with the Biden administration, we always appreciate your insights. Thanks so much for taking time with us today.
Appreciate it, Matt, and I'm happy to come back anytime, maybe in 6 months or a year, and we'll sort of see what happened in terms of getting over this dark period I was describing.
We will take you up on that, Chip, and please stay safe.
Thanks.
And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.